Hi everyone, this is Sue Doyle with OT Lifestyle Solutions, and I thought tonight we would talk a little bit about how to stop grandma from falling or preventing falls as we age. This is becoming a significant problem with 1 in 4 seniors reporting that they have fallen in the last year, and that is not a normal part of aging. Falls just don't have to be. And so we're going to just do an overview tonight on how to prevent them, but they can be prevented. The problem with falls is they lead to injury, reduction in activity. They can even shorten your lifespan, result in you having to move out of your home into a facility, and just a lot of other complications that we want to avoid. So what are some of the things we can do? Well, first of all, it's important to really look at your medications and what it could be. Talk to your doctor about a fall. A lot of seniors are really afraid of talking about falls. They're also embarrassed about talking about falls. So even their friends, family, and the doctors don't know that they've fallen. But falls can be a sign of some underlying medical conditions. It can be anywhere from as simple as a urinary tract infection to as complicated as something going wrong with your heart or having mini strokes. So it's really important to talk to your doctor and help them help you understand what's going on. The other thing we need to do is review all your medications. There's a lot of medications that can make you sleepy or drowsy or dizzy, and they can interact together to not have the best interest at heart and overall in terms of increasing your risk of fall. So again, this is really important that they're reviewed at least annually. Talk to your doctor, talk to your pharmacist. And often we have more than one doctor that's prescribing medications and they're not always fully aware of our other medications. So thinking about those are really important. The other thing is get your eyes checked. As we age, our eyesight changes, and poor eyesight doubles or triples the risk of a fall. And sometimes we can get progressives or bifocal lenses, and they can be a problem when we're walking because we have distances in that trouble with that walking distance with depth perception or distances. So you might need glasses just for walking to reduce your risk of falls. Also, our contrast sensitivity changes as our eyes age, and that is being able to see some of the depth changes in surfaces, changes in difference of a step height, what happens where there's shadow or shade or where there's darkness. In fact, we need much brighter lighting too in our home just to be able to see as we age. So it's really recommended you get an annual vision screen and follow through on what's happening there. And again, talk to your eye care professional if you're having trouble with near falls, judging distances, seeing when it's darker, seeing in certain areas. That's really key and important. Wearing good shoes. You know, a lot of falls are due to slip or trips. And good footwear is really important to help preventing that. High heels, floppy, well-worn slippers, the slippery on the bottom, slick soles, all of those can lead to a fall. You know, those real comfortable shoes that you can get into easy, but they don't stay on your heels and they flop a little bit or they're just well-worn. Those are not safe for walking in. Walking in your socks, particularly on slippery floor surfaces, things like tiles and hardwood, can also lead to a fall. So good fitting shoes are just as important. Good fitting slippers are just as important as good fitting shoes because often that's what we wear most around the house. If you have painful feet, you're having difficulty getting shoes that fit well, talk to your doctor and ask for referral either to physical therapy or to podiatry. There are often, if you have diabetes, you can now get diabetic shoes that are particularly made for you that can reduce that pain. If you have complications with hammer toes or painful toenails and things like that that can impact your getting shoes that fit well or walking, again, get those followed up with. Making your home fall proof. We're going to talk a lot more about some of these things coming up in more detail in other videos, but simple things you can do is improve the lighting. Make sure you have good overhead lighting and good task lighting. Remove the trip hazards. Those are things like thick throw rugs, rugs that the corners keep kicking up on, tears in the carpet or the linoleum. There are also things like power cords and leads that go across in front of our way. Clutter. Now, clutter can be just like clutter, we collected it, or it could be something that's sitting there on the stairs or sitting in the walkway because we're going to move it later. All of those are things that are in our way for us to safely walk somewhere. Non-slip surfaces are important if we're mixing water with those. So in the bath or the shower, making sure we look at that, and install grab bars if we need. Watch for a video coming up. I'm going to tell you how to choose a grab bar and how to select the correct place for it. Those are all important things. Keeping moving. Staying active is really important. And you know what happens once we have a fall is we often get scared of moving, or we get scared of doing that activity. You know, I just left from a client's house today and she said, I'm just so fearful of going in the bath. I rarely go in there once a week now because I'm just afraid. I've had 2 falls and I'm really scared. So it's really important that we figure out how to reduce that risk of falls, but then how to still stay active, because well, grandma used to tell me, if you don't use it, you're going to lose it. And as we age, we're automatically going to lose muscle and strength if we don't be very proactive about keeping it. We need to focus on our balance and we need to focus on our strength. We're going to have some videos coming up on some simple exercises you can do. But one simple thing is the more you walk, the less you fall. This is a quote from a researcher in gerontology at Oregon Health Science University. But that's key. The more you walk, the less you fall. So thinking about ways to be safely active so that you can increase your exercise activities. Limit your alcohol intake. Interestingly, as we age, we lose muscle, which means we don't push alcohol out of our bloodstream or our system as well as we used to, because fat just doesn't absorb it as well. And it impairs our balance and our reflexes. Interestingly, there's been some studies saying that the rate of hip fracture increases with the rate of alcohol intake. And hip fractures are A, painful, B, expensive, can limit your future life and quality of life and enjoyment. But the other piece we do know is they can shorten your lifespan. So thinking about as we age, we really want to prevent those kind of fractures, and this is one way of doing that. So what is your fall risk? Well, here we go. There's a fall screen. I'll put in the link when I post this on YouTube for you that will be underneath. But questions like, have I fallen in the past year? Have I used or have been advised to use a cane or a walker to get around safety? Sometimes I feel unsteady when I'm walking. I steady myself by holding onto the furniture. When walking around the home, I worry about falling. I need to push out from my hands with my hands when I stand up from a chair. I have trouble stepping up onto a curb. I have to rush to go to the toilet. I have lost some feeling in my feet, or I take medication that sometimes makes me lightheaded or more tired than usual. I take medicine to help me sleep or improve my mood, and I feel sad and depressed. You know, if you have answered yes to 4 of those, then it's highly likely that you are at risk for a fall. I'm going to put the link in there, book that test out. But what can you do? You can talk to your doctor. You can seek out an exercise program. You can ask for an occupational therapist to complete a home safety assessment, and watch for more videos from OT Lifestyle Solutions, because we're going to have some more details on what you can do at home to prevent grandma from falling.